FDA, which is the Food and Drug Administration, they've incorporated a new food label. Right now I'm going to go over the differences between the old food label and the new food label. One thing that the FDA decided to take into consideration is that obesity is a leading epidemic among Americans these days. We do find that obesity is also a risk factor for breast cancer. So it's really important that people with breast cancer or a history of breast cancer watch as far as their total caloric intake. One way to watch your total caloric intake is by watching your serving sizes as well. So the new food label is going to incorporate more of this. So you'll see, as far as this is the old food label here on the left, and then we have the new food label on the right. The old food label, you can't see the calories quite as well. Nothing's very bolded, hard for people to read. The new food label, things are going to be bolded. You'll be able to see the serving sizes much easier, and you'll be able to see the calories much easier. It'll be bigger and it'll be bolder. The next thing that people will see is on the old food label, we would see sugars. It would just be the sugars. Now you're going to have sugars, and then you're also going to have added sugars. We find in America that too many people are taking in sugar, white sugar, sugars that are not good for you. But we find that you get a lot of your sugars from foods that are already prepared. So when the consumer's looking at the new food label, they'll be able to see added sugars. And if you see a high amount of sugar in one product, you know you don't want to probably take in too much of this. It's been added processed sugars, white sugars that we don't want consumers to take in. The next difference that you'll see is the percent daily value is to the right of the food label now, where now with the new food label, we're going to shift the percent daily value over to the left. Percent daily value is the total amount based off of what a consumer is taking in a full day. So an example might be if they're looking at total carbohydrates. This one product has 12% carbohydrates, which isn't very much based off of 100% that a consumer should have in the day. If you see that this one product has 75% total carbohydrates, that's a lot, and a consumer may want to think twice before taking this in. The next difference that people will see is that vitamin D is added to the food label. Calcium and vitamin D are really important for brittle bones. So one thing especially, people who are cancer survivors and they've undergone treatment, they have brittle bones, so it's important to take in enough calcium and vitamin D. So now the food label will be able to tell you how much vitamin D is in a product, which is really important. A lot of breast cancer patients are on medications to decrease their hormone levels, and that also can create brittle bones, so it's important to make sure you're getting in enough vitamin D from foods as well. You'll also see an addition of potassium on the food label. Potassium is important because it can lower your blood pressure, and it also can prevent hypertension. Hopefully with these new additions to the food label, Americans will be able to watch their total caloric intake, take a look at be more mindful as to how much the serving sizes that they're taking in. Those that need to make sure they're taking in enough vitamin D, they'll be able easily to look at the vitamin D level, and that percent daily value will be right there for patients to see. And then also those added sugars, which are really important.